a student of Birla College and I have been born and groomed in Mumbai and Kalyan area. तर अशा घरच्या माणसाला चीफ गेस्ट म्हणून आपल्याच घरच्या फंक्शनला बोलावणं इज समथिंग विच इज अनयुजुअल. मला एकदाच नव्हे तर दोनदा इथे चीफ गेस्ट म्हणून येण्याची संधी मिळाली. म्हणून मी कल्याणच्या या मॉन्सून कॉन्क्लेव्हच्या मेडिकल कॉन्क्लेव्हच्या ऑर्गनायझर्सचं आणि सर्व संबंधितांचे अतिशय आभार मानतो. डॉक्टर प्रशांत पाटील, डॉक्टर रमेश पटेल, डॉक्टर राकेश पटेल आणि माझे मित्र डॉक्टर संजय गोडबोले आणि इतर सर्व, आणि त्याचबरोबर मला पितृतुल्य असलेले डॉक्टर RC शहा, सिनियर डर्मेटॉलॉजिस्ट आजच्या या ऑडियन्समध्ये आहेत. ह्या वयात सुद्धा नवीन शिकण्याची जिद्द कशी बाळगावी हे त्यांच्याकडनं शिकण्यासारखं आहे. माझा आजचा जो विषय आणि टॉपिक आहे तो कदाचित थोडासा लांबेल, तर घरचाच म्हणून ते तुम्ही सहन करावं. I will try to go as fast as possible. I really thank once again, and I again appreciate Dr. Chandan Singh, who has been with me for all my cases of supra-major, major cases of anesthesia. He is also here. Dr. Chandan Singh and I shared a different relation altogether. I never told sister or Dr. Ramesh or anybody that book the case, book the anesthetics. I personally always phoned Dr. Chandan Singh that when can I post, and then he would say at 6 o'clock in the evening, and that would force me to stay back in Patel Nursing Home or Gastro Care Hospital of Dr. Palchetkar on many occasions. But I never changed my anesthetics. Dr. Chandan Singh is there. I have chosen this topic today to talk. There are some reasons which I will talk at the end. This is my experience of managing COVID pandemic. Some people say that you have managed it little differently because you belong to a caste and community of surgeons, and the name of the topic should have been Surgeon as Commandant to fight the battle of COVID. In March 2020, the bell of Corona started ringing, and it was COVID-19 which was coming up. People were terribly scared. And Mumbai being the hub of international passengers coming, people were extremely worried that the Mumbai people will have maximum suffering of COVID, and therefore all the health authorities were alerted. I remember there was a massive meeting which I first time witnessed, in which all the collectors of Mumbai and peripheral areas were there. All the health administrators of private and public hospitals were there. All the medical superintendents were there. All the deans were there. Commissioner was there. Additional commissioners were there. And there was a massive meeting in the office of Municipal Commissioner Mr. Pardeshi. All the stakeholders, all the people who were vendors of municipal corporation were, called in, and how to battle this corona pandemic which is impending was thought of. The first thing was screen the patients who are coming from airport. If required, isolate them and quarantine, and therefore we were told that we must have a strategic place for quarantining them, either in the 5-star hotels, either in the 3-star hotels, or a hospital. And then it was decided that SevenHills is a strategic hospital which is very near the airport. And therefore, all the people coming from airport, if they needed to be quarantined in the beginning for a period of 7 days to 15 days, they could be located in SevenHills Hospital. But the problem was there that the SevenHills was partially owned by Municipal Corporation, partially owned by SevenHills Hospital Company Limited. There was a court dispute and the SevenHills had to be acquired for this particular purpose, which was almost like a Bhut Bangla. And then what happened that after being appointed as a Dean of SevenHills Hospital, the first encounter was started something like becoming a Dean of SevenHills Hospital. I was told by Commissioner that you have to handle this responsibility because you are senior in command. You need to start this SevenHills Hospital, you need to start first the workforce for screening the people on the airport. The Airport Authority of India, they shook their hands up and they said that they do not have any kind of medical or paramedical staff to screen such thousands of passengers which are landing up in Mumbai on the airport. So they said that this responsibility needs to be shared by Municipal Corporation. This responsibility needs to be shared by the Dean of the major hospital. And then I was told to look into it and go to SevenHills. A message came that how will you organize this so-called screening of the thousands of passengers which are coming every day on the Mumbai airport. And then at middle of the night, the Commissioner told me that we are starting the screening of the passengers from 12:01 when the British Airways is arriving from Heathrow, London first flight, 12 o'clock. We have to start screening, and then you will not believe that as a warden of the students' hostel, way back the experience I had, I went practically and took away all the students because a history had to be asked, a form had to be filled, a pulse had to be taken, saturation had to be seen, and temperature had to be seen. So I said that this can be done by medical students. So we collected about 500 medical students, put them into various duties, put them into various stations for receiving passengers which had to be screened and which have to be isolated or what is called as quarantine. And then I was told that you go to SevenHills, and an order came that I must take over SevenHills Hospital. There was a great challenge that SevenHills Hospital was not utilized for almost more than a year, and it was like Bhut Bangla. Bhut Bangla, there were pigeons, there were nets, there were jari, kachra, nobody was staying there. A lot of people whose salaries were stuck, they were not paid, and what not. CT scans were not working, MRI scans were not working, laboratory machines were junk. This was the problem, and then I was told to start SevenHills Hospital, and you go ahead and start the SevenHills Hospital and make it functional. To convert Bhut Bangla into a habitable hospital was the greatest challenge. I had to remain available for 24 hours. To convert the hospital into 1200 oxygen beds within a month and 300 ICU beds within a month, it was a mammoth task. Manpower was a question. What we did, lockdown was a question. That people could not transport, the public transport was off the track, the locals were off the track, the BST was off the track, so many challenges. The diet and the food was not available, the contractors could not fetch vegetables, contractor could not fetch anything. So they were unable to run the restaurant, they were unable to run the pantry of the hospital. Name one, and there were thousands of problems in SevenHills during the time of lockdown and during the time that the SevenHills was absolutely defunctioned hospital. And still I took over the challenge. I went and started staying in SevenHills. My own family was worried that what is this going on, and then Mohan Joshi might pick up. I am the only husband and I am the only father of my children. If I get COVID and if I pick up COVID, what will happen? So one day at day night, they visited my quarter. So this was the scenario, and what we did, that we started first. We paid all the dues of the employees, and the SevenHills Hospital employees were restored to their job. They all came, all the nurses came, they joined, they were staying in the quarters, they joined, and one by one we took up so much that in a span of almost a month, we restored the luster of SevenHills Hospital. We created 1400 beds, about 300 ICU beds, 30 dialysis machines, 4 negative suction ICUs, procured about 250 ventilators, monitors, infusion pumps, and the manpower was restored from agencies. We contacted people in Kerala. There were nursing agencies. They all came to our rescue. All the employees of the SevenHills Hospital were restored. Their dues were cleared. Nurses, floor supervisors, full pharmacy needing thousands of drugs, CT, MRI, all labs, molecular labs for RT-PCR, lawn, gardening, malis, everything was restored in a span of 1 month, day and night. And this was what I did in SevenHills Hospital. The New York Times, there were lots of news. I offered a lot of extra incentives to the manpower. I was criticized. New York Times produced a lot of news. Mumbai Mirror gave news. And I was there available 24/7. After a month, when I started about 1300 to 1400 oxygen beds, the corona was at its peak. 300 ICU beds with negative suction, corona was at its peak. And the mortality of the patients of corona in the state and in the city had gone up significantly. Because the patients needing critically ill patients needing ICU care had increased significantly, and the mortality was very high. The private corporate hospitals were unable to take over the load. They were also scared. They had their own problems of employees. They had their own problems of compensation. They had their own problems where they did not have manpower. The public transport was at stake. And therefore, the ICU care, whichever was available in the private sector, was extremely expensive, and they were not able to cope up the load. So the Chief Minister of Maharashtra then, Mr. Uddhav Thackeray, the Commissioner of Municipal Corporation of Mumbai, and the Chief Secretary, all of them had a meeting, and to battle with this increased mortality of critical ill patients, they decided that the medical colleges should step in, and therefore they decided that strategically located VYL Nair Charity Hospital or Topiwala National Medical College, which has got different buildings, H building, O building, for various patient care activities, could be converted into an exclusive COVID hospital, which was greatly resisted by Nair people, Nair resident doctors. And a time came that in the evening, the Chief Secretary of the Maharashtra State and Honorable Commissioner both phoned me, and they said that you have to develop this hospital. Now your job in SevenHills Hospital is over. You have to go ahead with taking over the Nair. And then on 19th April 2020, an order came that I should take over Nair Hospital and develop it as a full Corona hospital or fully developed, dedicated COVID hospital. And that order was signed on 18th April at middle of the night. In the morning at 6 o'clock, I got a phone call that please take charge. 19th April was Sunday. I said the order is not signed yet. I have not received the order. So how can I leave SevenHills and go there? They said that the order is signed, and I got a WhatsApp copy at 6 o'clock in the morning on Sunday. Take over the charge. In Nair Hospital, I had not gone because it was a new place. I was born in Sion. I was UG, PG of Sion, and I was working in Sion. Because the Sion Dean post was vacant, I had taken over as stopping my all private activities and private practice. I opted to become Dean of Sion. I never went to Nair even as the head of the department. I allowed my junior doctor, junior friend, junior colleague, Dr. Dharak, to go there as head of the department. So I was shocked with this decision. But somebody told me that good work is rewarded with more work. New people, new path, new strange enemy, and that is Corona. And I had to go and develop something called as dedicated COVID hospital, the first medical college of the country to be converted into all COVID hospital. It was highly disorganized that time. There were some Corona patients admitted. It was nobody's responsibility. They were admitted under nobody. They were admitted on one floor. They were admitted haphazardly. No specific beds were allotted to them. And no unit was looking after that particular patient, those particular patients. They were just, randomly admitted. 70% of the staff was absent. Death rate was very high. Everybody claimed that it is somebody's responsibility or nobody's responsibility. And there were enormous number of challenges because this is a medical college, and the medical college, when it is converted into dedicated COVID hospital, what will happen is that the radiology resident will not get a chance to do radiology procedures. A surgical and orthopedic resident will not be able to nail or hammer what he wants to do, the fracture sites, and the surgical resident will not get motor skills or will not develop motor skills. So everybody was against developing dedicated COVID hospital, but it was a need that the medical college should come up. Medical college, the professors and the intellect of medical college of professors should devote now, because the large amount of patients were dying. And therefore, it was a need of the society, which I tried to convince them. And we started working on every possible problem. The problem was of transport, the public transport, and mind you that a person named Surendra Kumar Bagde, who's seen there, who became my close friend, who was the managing director of BST. Remember that the BST never crossed their Bombay limits. Once they tried to cross Bombay limits by route number 30 and came to Thane, Thane people criticized it very, very bitterly. So much so that BST drivers were beaten up, BST conductors were beaten up. Once upon a time, when the BST bus came to Thane, BST never crossed Bombay Municipal Corporation borders. But this person named Mr. Surendra Kumar Bagde, he said that I'll be with you, you tell me what to do, and you will not believe that the BST crossed their borders. They went up to Nala Sopara, they went up to Topiwala, they went up to Kasara, they went up to Badlapur and Khopoli and picked up our employees and nurses. Resident doctors, to get accommodated even one night was a dream for many doctors, many full-time teachers in Old Taj. And Mr. Ratan Tata and his group came forward so much that they offered their own hotels to our employees at a cost which was negligible, and we could accommodate our resident doctors and nurses in Old Taj. And then day by day a new hotel came up, and they said you could accommodate your employees, and all municipal employees were accommodated in 5-star hotels at the cost of tourist hotel. And the cost, we took care of that cost. So this is what happened. Because despite that the BST offered, somebody who is living at 11 o'clock from night, a lady living and coming on a deserted street at Badlapur or Kalyan, on a deserted place in Kalyan, at about 2 o'clock was a concern to me. So we accommodated everybody in all the best possible hotels of the country, or of the best possible hotels in the Mumbai. What we did in Nair, that we did something called as floor-wise arrangement. Earlier the patients would come and they would get randomly distributed. What we did, that we had something called as a ward, which is suspect ward. If he becomes corona positive, he goes to corona ward. In a specific unit of the day, the people would look after, and this is what we did: a suspect ward, then floor-wise arrangements of the unit, installation of ventilators even in suspect ward, distribution of patients as per the need, if they are positive or negative. X-rays started, CT scan started, lab started, and all the units were given, specific days to work. Strict action against absenteeism. Those people who were absent, who were unable to come, he said that, where do you stay? He said, I stay at home. Either you want to come and get accommodated in the hotel, you come and get accommodated in the hotel. BST bus will pick you up from hotel and drop you to Nair Hospital or KM Hospital. BST bus will pick you up from Badlapur and drop you back to Nair. We created a dormitory type accommodation even in the hospital where people did not want to go to hotel. So this is what we did. Now, therefore, not only that strict action against absenteeism, but we started offering monetary incentives. Anybody who worked for 8 hours, during the time of Corona, his accommodation was looked after, his transport was looked after, his eating and everything, boarding was looked after, and not only that, we gave him extra incentive of 300 rupees per day for 8 hours. Then a stage came that people were still scared. They were worried that they said that I'm above 55. Somebody would increase the age unnecessary and would say I'm much older. I cannot go in corona patients. So monetary incentives, strict action against absenteeism. Those who could not come, we made them managers. You have to look after the manager. You may not go to the patients, but you have to look after all the supervisory activities, either from my office or somewhere else. We recruited first 100 nurses, student nurses. I said that the student nurse who is a second year and third year, they are at par with staff nurses. So we trained them for corona, and we appointed first 100 nurses and subsequently hundreds of nurses from every medical college, and we had a good amount of nursing staff which was overzealous. We gave them incentive of 15,000 per month. And whatever I proposed, it was accepted by Honorable Commissioner Mr. Kapani and Mr. Pardeshi. And then it happened. Then we started doing outsourcing of the multi-purpose employees. Multi-purpose employees could be outsourced. The agencies came forward. We appointed rather large number of multi-purpose workers, patient care attendants, ward boys, etc. And did something called as punitive action for those who were absent. So monetary incentives, action against absenteeism, recruitment of student nurses who are young and enthusiastic to work, and all of them were given certificates that they are corona warriors, outsourcing of multi-purpose employees. This was something which we did, and we could come over the personnel problem in the hospital. This is something which we started first time. The concept came in Nair Hospital, what is called as screening OPD or SSO, entry point of the hospital. We picked up patients. We never said no to anybody. About 180 to 200 and later on 300 patients went on coming to SSO, screening OPD. Provision of smart OPD was made, All essential facilities like ECG, oxygen, everything was kept in SSO. It was a new casualty which was designed for corona patient. Blood collection was done, swabs were taken, and immediately patient 24/7, because Nair Hospital has got 20 buildings. Walking patient who is ill becomes difficult. Roads are not as smooth, so therefore pushing them on a trolley was difficult. So I hired 24/7 ambulance, and in an ambulance I pushed these patients to various wards or the suspect wards, and this is what we did. We augmented the beds of Nair Hospital, which was to start with 200 beds of corona. We augmented to almost 1050 beds or 1043 beds, 110 maternity beds, 500 beds of intensive care, and we also started the first neonatal intensive care unit for the patients who were born out of corona mothers, and this is something which is very important. I have seen the MLAs and the MPs driving, sitting near the driver of the ambulance, keeping 4 to 5 corona patients backside of the ambulance for dialysis, traveling from Kulaba to Mulund and traveling from Kulaba to Borivali. Nobody would say that I would dialyze a patient who is corona positive. The patient's creatinine would rise, and therefore we started dialysis intervention in Nair, and we bought almost about 30 machines and 70 to 80 dialysis patients we could do, and we augmented the intensive care, and this really helped. So comprehensive care could be offered in Nair, where critically ill patients were straight away sent to something called as ICU, which had a specific negative suction ICU, so that there is no way of cross infection. We had suspect ward, we had intermediate ward, and every bed was provided with oxygen facility. And Nair became not only India's but one of the best medical college which was dedicated to COVID in the country, probably in Southeast Asia. A very touching incident I want to tell you how the Nair maternity was born. A lady, I will not name that lady, I will not name that hospital. What was the fright in the mind of people during the time of Corona? It was much, much worse than what was seen for, say, leprosy or what was seen for something else. People thought that it's a dreaded disease. People thought that it has got dismal prognosis. People thought that death was almost sure if you get corona. And a touchy incident happened. A lady from a very high profile family, very educated, very literate, very rich, was following up for 9 months in a private corporate hospital in Bandra. Lady delivered at 1 p.m. in the afternoon. Her report of corona came positive at 4 p.m. Within few minutes, the husband vanished. The relatives disappeared. And the hospital where the patient had, the hospital had committed to look after her in a postpartum phase, that hospital said that this patient needs to be transferred to a corona hospital without a relative, without a husband. With few hours, a child who is few hours was pushed in 108. Go to corona hospital. The driver was so nice that he went on going ahead with each and every hospital, waiting there. Is there a corona bed? Is it anybody is ready to accept this lady with 4 hours life, 4 hours age of the child? And he got fed up. He got fed up. Nobody accepted him from Bandra to Nair Hospital. Eventually at 2 a.m. in the morning, the child and the mother both were brought and dropped at Nair Hospital. Go here, find a place, I am going away. And the child and the mother had to be admitted, and that was the time that we took birth of Nair maternity, which had largest number of COVID deliveries, and almost all children were negative, and there was no mortality. Nair gynecologists supported me very wholeheartedly for this project, and that was the birth of Nair maternity. And this was the scenario. We delivered triplets, we delivered twins, and so many things about Nair maternity to tell. None of the babies turned positive. All babies breastfeeding had to be told to them with a tight mask how you can prevent corona to the child but continue to breastfeed the babies. All babies were completely immunized as per the schedule. And we had a pride of running Nair maternity, the Municipal Corporation. We had a problem with the investigations, that we had to do advanced investigations, inflammatory markers, etc. And therefore we tied up with ThyroCare. We had a lot of portable X-ray machines, and large number of CT scans were encouraged for this particular disease. We were the first to get plasma as an administrative method or as a treatment modality for COVID. ICMR approved the first trial on plasma therapy. Plasma is obtained from the patients who were COVID positive. We had a drive for getting plasma for the patients who had COVID positivity. And after 3 weeks or 6 weeks, they came, donated plasma on a plasma fractionation machine, and we started this plasma therapy that gave a boost to several people, and that was the first trial which we had. A machine worth 78 lakhs was given by Tata Trust within minutes. First to get permission from ICMR and FDA of Delhi, FDA of India to start this organized campaign. We had organized campaign for getting plasma, vehicle, phone, alarm, 6 to 10 people donated plasma every day, and that was used for all patients of COVID. The oxygen requirement had increased to 1,000 folds because everybody was getting 30 liters of oxygen, 5 liters of, from 2 liters to 30 liters, every bed was oxygenized, and therefore we needed 1,000-fold oxygen delivery. And we had to increase the number of plants of oxygen. We had to change the pipelines. But even for changing for a minute, we installed the pipelines which were of bigger caliber. But to switch over from old pipeline to new was a great concern because thousands of patients were on oxygen. And suddenly stopping oxygen for even 5 minutes created problem. I personally supervised and I knew what happened to my heart that time and how much the heart rate had increased and how many deaths could occur suddenly if we don't connect it to the new line. And practically a new line was put near every patient, and we did that, and a lot of oxygen people helped me, Inox as well as IOL, as well as the contractors who did that, and we literally did it. And keeping something called as jumbo cylinders, keeping something called as very big oxygen concentrators near the patient. We used advanced drugs. There was no problem. Municipal Corporation sanctioned and offered free remdesivir, which was a difficulty. When the minister would send a person that give me one vial of remdesivir, that was the problem. We had for advanced modalities of treatment for treating the patient. We improved the supportive care. We improved the personnel management. We had a unit and floor management. We had SSO or screening OPD, and we had changed the mortality, which was very high, to a reduced mortality by a healthcare management which was great. We had research which was very aggressive. We had a itolizumab trial, tocilizumab trial, first trial of placid, ICMR trial of plasma, efficacy of remdesivir versus no remdesivir, and then a specific way of giving physiotherapy in prone position was devised by our own contemporary colleagues of Nair Hospital. And we had psychotherapy. There was a problem that the patients would feel that they would be going on oxygen. They would not return. There was a great depressive effect, not only in the patients, but even in doctors, in resident doctors. They would put a WhatsApp message, suicidal message. An orthopedic person who is tuned up for nailing is managing something which is ventilatory care, is managing something which is inverse eye, is managing something called as oxygen ratio on a ventilator. They were all frustrated. There was lockdown, there was no transport, and they would go into a so deep depression that we had to go and even canvas, locate a resident at middle of the night at 2 o'clock and give him psychotherapy, get him out of that. Promotion of donors for plasma, because we believed that time that the plasma therapy will induce immunity in the patient who is suffering from corona, and we published 7 papers. This is a book which we came out. It is the largest book. It is the thickest book on the clinical management of COVID-19, which was inaugurated in the hands of Honorable CM Mr. Uddhav Thackeray then in Sahyadri Atithi Gurva. The comment of the Honorable Chief Minister then was that मी आणि बाळासाहेबांनी असंख्य पुस्तकाची उद्घाटन आणि प्रकाशनं केली, पण एवढ्या जाड्या पुस्तकाचं आणि मेडिकल पुस्तकाचं उद्घाटन करण्याची संधी मला आयुष्यात प्रथमच मिळाली. This was something which is great. This book has become a world reference book for the management, clinical management of COVID. This book has become popular in all the countries of the world, and I could get the opportunity to be the editor-in-chief and write 5 chapters in this particular book. This book covers, starting from COVID, the history, vaccination, various vaccines, treatment, management protocol, everything, all the possible therapies on COVID is covered in this book and was published in the hands of Honorable Uddhav Thackeray. This is our contemporary colleague, Dr. Chaya, and Alka Subramaniam from Nair, who worked relentlessly. Chaya is the head of the Department of Physiotherapy. We developed physiotherapy modules which became popular not only in India, they became popular in the world. They became popular in America, they became popular in UK, and they were well appreciated. The modules and the video cassettes and the video links were appreciated on YouTube by various people in the world, and it became a popular physiotherapy module for COVID. And Dr. Alka used to go even at middle of the night to do something called as for the patient, as well as something called as for the doctors. Psycho boost therapies she used to give, and in between we had something like entertainment programs of Sonu Nigam and Dr. Mukund Jagannathan. This was something about my journey of COVID, what we could do in COVID, and why I chose this topic. Because I strongly believe I will tell you 2 or 3 small stories about the intellect of medical people in Kalyan. I have spent large amount of time practicing in Kalyan in my life, and I learned a lot. I will tell you one story of a patient who was from Mumbai. He was complaining of gross pain in abdomen. And he was thoroughly investigated by doing upper GI endoscopy, lower GI endoscopy, CT scan. And only one abnormal finding which I could get was that he had a huge non-communicative cyst in the liver. So we decided to operate him in Kalyan, in Patel Nursing Home. And Dr. Patel and I used to have a discussion and dialogue before we could post the patient, and we did it laparoscopically. Dr. Patel is a great clinician, and Dr. Patel said that Mohan, I am not convinced the cause of pain is a liver cyst. But Patel, I told him that Ramesh, ऐसा है कि this patient is having pain and there is no other finding which I am getting in any part of the abdomen and complaint of pain. We operated him. We developed a biliary fistula. I did his ERCP, pushed a stent, which was something called as Christmas tree stent. Inside, he had still pain. Then I thought that the pain is because of the flaps of the stent. We removed the stent. His leak had stopped. Still he complained of pain. And then I said that you are going home now. He's supposed to go home and you take these tablets. He was a bad smoker. And then on the day when he was discharged on the round, he started vomiting and he started having very guarded abdomen. We had to explore him. And I saw from esophagogastric junction to almost rectum, everything was gangrenous, including liver and spleen for the first time in my life. Patient died. I learned that Dr. Ramesh Patel was right. The second case, which I tell you, is a case where somebody said several sonographies, somebody said that there is a likelihood of a small stone at the lower end of the ureter, in the left ureter of one of my colleagues' mother, friend, Mrs. Pandey. And then we started her on hydrotherapy. She continued to have pain, loin pain, left loin pain. Then I said, you repeat the sonography. 3 sonographies were done at various places, including one at Mahim and Dadar. They stayed in Rambagh, so they went to, I had given some other sonographist cheat. They went to Nidam, to Dr. Prashant Patil. And mind you that Prashant Patil on sonography delineated the lower end of the ureter with no acoustic shadowing, saying that this is a tumor in the lower end of the bladder, and we had to do a Boaris flap for that patient. And eventually, after a few years, again second and third surgery, she died. So such intellect of radiology is in Kalyan. And therefore, why should I take a medical topic to train? So therefore, I took this topic as my experience of COVID in Mumbai to avoid talking on anything which is surgical or my endoscopic. I could learn the best possible laparoscopic surgery with Dr. Palchetkar and see the beautiful fundoplication being done, that nobody needs to go to Coimbatore, but go to Gastro Care Hospital, Kalyan. Kalyan has the intellect. And after becoming dean, I miss coming to Kalyan. I miss interaction with my father's friend, who's like my father, Dr. R.C. Shah. Thank you so much for calling me here.